अस्सलाम वालेकुम। एक सेकंड। अस्सलाम वालेकुम। कैसे हैं आप लोग? उम्मीद है ठीक होंगे। चलें, we are welcome you all here. I am Dr. Mohammed Ali Rabbani. I'm assistant professor anatomy, and inshallah I will be your guide for this session today. Today we are trying to embark on a new journey. We will. It is an 11-day course, totally free for all, as you have joined live, and some of you will see it later in a recorded session. There will be daily 2-hour session for the gross anatomy for the next 11 days. I will try my level best to cover the subject of head and neck during this period to the best of my abilities. And in the beginning I would like to ask you, so be a little gentle with me. I hope so. It would be, I'm a human. If I make a mistake, please bear with me, and please do mention in comments if you have any suggestions or any corrections in mind. About topic of today, currently we are going to start the osteology of skull. This is our topic for today. We will see skull in the different views that are also known as normas. Most of you, a lot of you are reading BD Churasia. So the language that is used is Norma Frontalis when you are looking from the front, Norma Lateralis when you are looking from the side, Norma Occipitalis when you are looking from the back, Norma Basalis when you're looking from the base, and Norma Verticalis, not shown in this current slide here, but you, when you look from the top, you see the different views of the skull. The skull is made up of a large number of bones, and it is divided into two parts. The part which houses the brain itself, that is called neurocranium, and the rest of it that is making the face, it's actually a part is overlapping. This will be viscerocranium, the one that you see on the Norma Frontalis, that will be viscerocranium. So we will go through them one by one. Let's start with the easy aspect. I will be moving from Norma Calvaria, then Norma Frontalis, Norma Lateralis, and interior of the skull. In the last, we will go to the base of the skull, and we will try to move the mandible topic. When we will do the temporomandibular joint, inshallah we will cover it with that. The superior view. What are the bones? This is the Norma verticalis, Calvaria. What are the bones that are forming the Calvaria? If you see, you can send your queries in the live chat. Inshallah, I will try to answer as best as I can. Superior view, it includes 4 bones. On the front, there is a single bone, that is frontal bone, shown in the blue here. On the sides, there are parietal bones. On the back, there is an occipital bone. There are 3 sutures visible in this view. The one running from left to right. In the coronal plane, this is called the coronal suture. As you can see, it is running between the frontal bone in front and the parietal bones in the back. Between the two parietal bones, there is this and sagittal suture. It is in the sagittal plane of your body, and it is between the two parietal bones running from front to back. And this one is the lambdoid suture. You may remember from the physics lectures of FSC and O levels that this symbol was called lambda. So it is something like that. So this is the lambdoid suture. It is between parietal bones in front and the occipital bones in the back. Let me show you the same things uh, here. Just give me a second. I'm a little new to this, so okay. So here is the skull. This is the frontal view in which you see the face. This is the lateral view. This is the occipital view, and this will be the vertical view. Till now we have discussed the frontal bone here in the front, parietal bones here, and if we move back we will see occipital bone here, and we have seen coronal, sagittal and lambdoid sutures. Here you can see the 2 points where the sutures meet. What are the 2 points? This point where the coronal and sagittal suture meets, this is known as point bregma, written here. And this is the point where the sagittal and lambdoid sutures meet. This point is called lambda. These points are very important from examination point of view also, as these are the points those presents as a soft parts in a neonate skull. In a neonate skull, in a newborn, the bones have not yet met. So the point where more than one sutures meet, here the coronal suture is meeting the sagittal suture. This part is called before fusing anterior fontanelle. You are asked that what is the date of the fusion of it. It is roughly 1.5 year or 18 months. Here you can see an interesting thing. This suture was not visible in adults. This is called frontal suture or metopic suture. Originally, the frontal bone developed as two independent bones and they fused in the midline by the age of by 8 years of age, and they met and the suture vanished between them. This is called metopic suture. And so, technically speaking, you will say that the front anterior fontanelle is present between metopic, sagittal, and two coronal sutures. And so here is a posterior fontanelle. These are the soft spots that you may find in a newborn here, and this closes by half to 1 year. Usually it closes by 1 year. Okay, let's see what other features are present here. Let me move to the 3D model. In the 3D model, you can see, first we'll see what are the highest point. If what is the anatomical, how you arrange it anatomically. So there is the orbit. Here is the orbit. It is the inferior margin of the orbit, and here is the external auditory meatus, this point. So there are two ways of defining the anatomical plane, anatomical positioning. First, there is a rides baseline, rides line. So what we do is we take this inferior margin of the orbit and we take this middle of the external auditory meatus and we get them in one plane. We'll just do like this and like this. So this point and this point will be in one plane. So this is one way of putting an anatomical position. And second point is you take this point, inferior orbital margin, and you take this point, the upper margin of the external auditory meatus, and between them there is a Frankfurt line. So between this is the anatomical position of the skull. So if we put it in anatomical position and we look at here, so roughly this would be the part where the skull at its highest point. You can see that it is behind the lambda. It is behind the bregma, sorry. So this is the highest point, the vertex of the skull. And if we look for the other aspects, what other features are there? We talked about the bones, we talked about the sutures, we talked about the points where the two sutures meet. A very prominent feature that you can see here are two these two foramina. This one, let me and this one. So these are the two foramina. These are the parietal foramina. They give passageway to the emissary veins from the superficial veins of the skull to the sagittal sinuses that are present beneath them. And if you join these two bones, these two lines, this, you join these two lines, this point where this line is in the midline and where this line is joining the sagittal suture, this point is called obilion. This point is called obilion. So this is about obilion. We've talked about vertex. Obilion is roughly 1 to 2 inches in front of the lambda. So these are the only features that you must remember. A quick revision: the four bones: frontal, parietal, occipital. Three sutures: coronal, sagittal, lambdoid. 2 points of meeting of sutures: bregma, future of the anterior fontanelle that was closing at 18 months, lambda, future of the posterior fontanelle that was closing at 1 month, and then there is the highest point as defined by the anatomical positioning of the skull. So it is in front of the this obilion, it is ahead, it is anterior to the obilion, anterior to the parietal foramina, and these are the parietal foramina, and in between them there is obilion. So these are the structures that are present from the that are seen from the outside. So what are the structures that can be seen from the inside? If we cut the cap and we take it up, this is called calvaria. The skull cap is called calvaria. If we look inside, first, before going into the features, I will take your attention to this. I will take your attention to this cut end of the bone. You can see the cut end of the bone that margins are thick and the spongy part is present between them. So this particular arrangement, the compact parts of the bones are called diploid. DIPLOE. Here is it written, diploid. So diploid आपको दो diploid दरम्यान वाला और दरम्यान में साइडों पे टेबल्स, तो ये आपको एक सैंडविच की तरह का एक स्ट्रक्चर मिलता है जिसके अंदर compact bone is on the sides and spongy is in the middle. What other things can you see here? Almost the same. There is the opening, there is again the same number of bones, same sutures, same points of joining of sutures, and the same things. Here are a few additional things are here. One, there is a groove running antero-posteriorly. This one. This is called groove for superior sagittal sinus. We will have a topic about the sinuses. So the superior sagittal sinus is lined against this point and it has created a groove here. It is narrow anteriorly. As we move back, it receives more and more veins and it gets larger in diameter. So there is this groove. Then there are these, a lot of pits are seen here. These pits are seen here, here, and as you move back, they become larger in size. These are called fovea, granular fovea, or actually there the CSF gets absorbed. Here CSF gets absorbed and the arachnoid granulations that are formed again in the sagittal suture and the sagittal sinus that are made at this point, and they push against the bone and they create these spits, and these are known as fovea. And one last thing that is to be seen here is these markings. These markings, as you can see here. So these are the basically the markings of the arteries, the meningeal arteries that are supplying the meninges. They have created an impression in the bones. Middle, mostly they are from the middle meningeal vessels, and they have anterior division and the posterior division, and they form anterior and posterior division respectively. You will see it later that it will become important, the grooves, that one of the groove passes the point where the four bones meet, the pterion, and we will see in the lateral view of the skull. So this is about the vertical, the calvaria, the vertical view and the inside view of the calvaria. If you have any question, please comment on in the live chat, and inshallah I will try my best to answer these. So let's move on to the anterior view of the skull. I will be moving to this again. Oops. Okay, let me get it straight. I have, okay, we will go through the same routine. First, let's see which bones are there. Then we'll see which sutures are there. Then we will focus on the individual. Okay, that's nice. Okay, let's see what bones are visible here. First, I'm just naming the bones. You can see here the frontal bone. The frontal bone that is making most of your forehead. This is the frontal bone. This is making most of your forehead. By the way, I'm using 3D4 medical anatomy model if you want to check it out and look online. So this is the frontal bone. This is making part of the forehead, upper part of the orbital, and here it is marking root of the nose, and it is making a lot of things. Then this is the bone that we can see here, the maxillary bone. There are two bones, maxillary bone, one on the right side, the other one will be on the left side. Then there is a cheekbone, the one you see here. This is the zygomatic bone. Then you see these bones. These are called nasal bones. These are nasal bones, right and left nasal bones. So these are the four major bones that you see on the surface. The frontal bone, uh, the the frontal bone, the maxillary bone, the zygomatic bone, the nasal bone. You will see the apertures here. There are two apertures that are visible here. One will be this one will be this one. This is orbit. This is orbit. One will be this one. This is the nasal aperture. So we will look at these also. So let's see the sutures where the bones meet. I will go into the bones in the orbit when I go into that topic. Frontal bone. Which bones is frontal bone joining? If we stay at the Norma verticalis and Norma frontalis, you will see that there is a hint of the metopic suture that is present here, where the two bones meet. It's not visible here. Here, there is the joining between frontal and nasal bones. That is will be frontonasal suture at this point. Here, the nasal and maxillary bones are meeting at this point. Between these 2 points, so there will be frontomaxillary suture. Here at this point, frontal and zygomatic bones will be meeting. That will be frontozygomatic suture. And here the zygomatic and maxillary bones are meeting. So that will be maxillary zygomatic suture. And again, there is a suture between the two bones here, maxillary bones here. You can see all of these structures here. Frontal bone shown in the blue here, zygomatic bone in the orange. There is the maxillary bone, and here are the nasal bones. Let's talk about the features that are present on the frontal bone. Frontal bone, there is a flat surface, the frontal bone. Here it is making the upper margin of the superior orbit, and here you can see there is a dip, and sometimes there is a foramina. Sometimes there is a foramina, sometimes there is a notch at this point. If you can see my mouse cursor at this point, let's zoom on here. So here it is shown as the foramen. This is known as supraorbital foramen, or if there is a notch here, that will be known as supraorbital notch, and it is making the upper margin of the orbit. Then okay, then if you see, it is very subtle in here. This is the raised portion here, this portion and this line, you can see the raised portion. So these are known as superciliary arches. These are known as superciliary arches, supraorbital margin. These are the supraciliary arches. And on this, you will see, just give me a second. Okay, just give me 1 second. Just stay here. Okay, I'm back. So where were we? We were talking about the frontal bone. We just talked about the part that is making the forehead, the part that is making the supraorbital margin, that contains the supraorbital notch or supraorbital foramen. It depends from skull to skull. There is human variation, and on the top of it, here there is superciliary arches, and on the superciliary arches you may be able to see nasal of prominence, frontal tuber, frontal prominence. This area here, at this area you may be able to see a little on the shade here. This area I am focusing the mouse here. So here, this part, superciliary arch, you may be able to palpate on yourself also. On the medial aspect, medial half, the superciliary arch, it is little raised. It is known as frontal eminence. Okay, the superciliary arches, if we join them by imaginary line, let's say here, let me get the pen. So this point where the two superciliary arches roughly meet, so here roughly, so here where the two superciliary arches meet, that is known as glabella. Okay, this is known as glabella. And then the point where the two sutures meet, here the point where the frontal suture, the frontal bones and the two nasal bones meet, that this particular point, this is known as nasion. This is known as nasion. So this is what the frontal bones. Let's get to the orbit. अच्छा, ऑर्बिट जो है इसको हम देखते हैं. ऑर्बिट, हाउ इज ऑर्बिट बीन फॉर्म? Orbit, we will look at the margins, that are structures that are forming the margins of the orbit. This will be the superior margin, supraorbital margin. This will be the lateral margin, inferior margin, infraorbital margin, and medial margin. And you can see it is like a pyramid that has fallen on its side. So this point is the apex of the pyramid, and here will be the defining points of the walls. So we will look at the floor, the lateral wall, the superior wall, and the medial wall. So how this orbit is formed? So let's jump into it. You can uh, put the answers in the live comments here. So which structures are forming the superior margin of the orbit? So here is the superior margin of the orbit. It is being formed by which bone? You can use the abbreviations here. It is been formed by this frontal bone only. So this frontal bone is making the superior margin. Okay, what structures is forming the medial margin of the orbit? Here, this and this bone. Okay, here you most a lot of people in my, I am tempted to write about this bone. This is the lacrimal bone, but just to keep in mind, the orbit margin, it passes in front of the lacrimal bone. So lacrimal bone does not, yes, thank you Abdullah, lacrimal bone does not come into the margin of the orbit. So which two bones are making the medial margin of the orbit? Here it is the frontal bone above and maxillary bone below. Okay, which structures are forming the lateral wall? There will be two bones. Above it will be zygomatic bone, the frontal bone, and below it will be the zygomatic bone. And of course there will be frontozygomatic suture between them. And which structures are forming the inferior margin? Inferior margin will include laterally the zygomatic bone and medially the maxillary bone. So these are the margins of the orbit. Okay, so let's get inside the orbit a little. Let's try to find which structures are forming which walls of the orbit. Let's look at the roof. Wonderful. Yes, let's look at the roof. The structure that is forming the roof of the orbit, that is totally wholly the frontal bone. We are not going into the detail of the individual bones, but that will be the front occipital, the orbital part, orbital plate of the frontal bone, the part of the frontal bone that is lying in the roof of the orbit. That is also forming the floor of the anterior cranial fossa. That is the roof of the orbit. Okay, let's look at the inferior wall. Inferior wall, who is making the inferior wall? Yes, let's look at here. The inferior wall. Inferior wall is majorly being made by the maxillary bone here, but there is some contribution from the zygomatic bone on the lateral aspect also. In the inferior wall, there are interesting things to be seen here. Here, this particular groove is seen that converts into a foramen right here. What are these structures? Because they are in the inferior of the orbit, these are called infraorbital. Here it is called groove, here it is called foramen. So these are in the inferior aspect, these are infraorbital groove, infraorbital foramen. They run in the inferior aspect of the base of the orbit and they open into the front of the face, in front of your cheek, right here. So that is the infraorbital foramen. And here between them there is an infraorbital canal. And the contents will be also known as infraorbital artery, infraorbital vein, infraorbital nerve. We will go into the detail later. So these are the structures that are forming the roof floor. Okay, let's get to the lateral wall. It is simpler. It is made up of two bones. Here in the front you can see the zygomatic bone. In the back you can see the sphenoid bone. This particular portion is the greater wing of sphenoid. This particular portion is the greater wing of sphenoid. Then comes the medial wall. Medial wall, it started from here, from the zygomatic bone, but zygomatic bone usually remain to the anterior margin, so medial wall will start from here. Lacrimal bone. Here the lacrimal apparatus, the lacrimal sac is present. Then there is the ethmoid bone. While reading the book, you will read a word uh, lamina cribrosa. Lamina cribrosa means it's sorry, sorry for that. Sorry for making a wrong statement. Lamina पेपरेसिया को स्पेलिंग के कुछ शायद मेरी मिस्टेक हो गया, यानी पेपर थिन लेमिना, लेमिना पेपरेसिया। तो ये आपको अभी अगर आप गौर करें तो इस जगह के ऊपर आपको यू में आपको एथमोइड साइनसेस नजर आ रहे होंगे थ्रू द बोन, बिकॉज इट्स सच अ लाइट बोन that you may be able to see the sinuses through it from the inferior aspect. Then comes this bone. This is again sphenoid bone, but you can see it is different from, there is a gap between the part that we saw in the lateral wall, so that is known as the body of the sphenoid bone. Okay, so these are the structures that are forming the walls. The roof by frontal bone, the medial wall by lacrimal, ethmoidal and body of sphenoid bone, and the floor by maxillary and zygomatic bone. Here I skipped a bone that has a very small contribution, that is this bone. This is, if you are up to it, remember that it is a part of the floor, it is a part of the palatine bone. It is a part of the palatine bone, is the orbital part of the palatine bone. And then there comes this, the zygomatic bone and the greater wing of sphenoid. So we are done with the margins of the orbit and the walls of the orbit. Let us look at the openings which are present, which is connecting orbit to the other structures. First, zoom out. Simply, orbital margin is the largest of the openings that are present in the orbit. जो सामने वाला बड़ा सारा सुराख है जिसके हमने 4 मार्जिन देखे थे. So this is the largest of the opening. Then there is this supraorbital margin, supraorbital groove या supraorbital foramen. In the medial aspect, if you look, let's look at the medial aspect. If you look at the medial aspect, you will be able to look at this lacrimal foramen here, this anterior ethmoidal foramen, posterior ethmoidal foramen, orbital canal. So these are the structures that will be found in the uh, medial wall. These will be posterior ethmoidal, lacrimal, and optic canal. So these are the structures that will be found in the medial wall. You can see the lacrimal opening a little better here if you see like this. And okay, if we look at the back, just near the orbital margin, you will see this opening. So this opening is called supraorbital groove, supraorbital fissure, supraorbital fissure. So this is the supraorbital fissure. It is present between which bones? It is present between the body of the sphenoid bone medially. It is present between the body of the sphenoid medially and the greater wing of sphenoid laterally. And if we trace it laterally, here it is present between the lesser wing of sphenoid and greater wing of sphenoid. If you remember from the neuroanatomy, it is connecting the middle cranial cavity to the orbital cavity. Okay, then look at the floor. We saw one structure before. We will see two openings. One opening we saw already. So this is the opening for the infraorbital groove and infraorbital tunnel. And here, this fissure, this is infraorbital fissure. This is infraorbital fissure, and it is present between which bones? It is, if you guess it, you can see from the hair, it is present between the, which bone is this? It is present between the uh, greater wing of sphenoid and the maxillary bone. And which structure does it, which cavity does it lead to? It is a little ahead of time, but I will tell you regardless. It leads to here two cavities. Here, if you look here, it will lead to pterygopalatine fossa, and here it will lead to infratemporal fossa. Laterally, it leads to infratemporal. Medially, it leads to pterygopalatine fossa, fissure fossa. Okay. Which other openings are there? There is a two openings on the lateral aspect here. You may be able to see right now. Let me get the image I want to get. Here, you may see these two openings. These both are present in the zygomatic bone. So these are known as zygomatic openings, and the one that is opening in the zygomatic bone to the anterior facial aspect of the face, that is known as zygomaticofacial canal, and the one that is opening to the temporal aspect, that is known as zygomaticotemporal. So you see here is the zygomaticofacial. It opens right here on the front of the face, zygomaticofacial, and this is the below one. This is the zygomaticotemporal one, and it opens all the way back somewhere here. You may be able to see it right there. So this is the zygomaticotemporal. So this is the zygomaticotemporal. So this is all about the orbit. Let me get back to the presentation. Okay, I'm going to take a half a minute breather. Just look at the slide and check if anything is remaining. If any have question up till now, ask me a question and I will move on from this after a minute from this point onwards. Okay then, by now you must have done the forehead, the orbit, the different bones that forming the orbit, the different foramina that are forming the orbit. I have not discussed the structures that are passing through the foramina. We will leave it for the day when we will discuss the orbit and its contents. And let's move on to this bone, nasal bone. Let's see which connections which it's making. On the superior aspect, nasal bone is joining with the this bone, facial bone, or frontal bone, frontal nasal suture. At this particular point, where the at the medial aspect, because the bones are placed like this, slanting, so the medial aspect is also anterior aspect. So you will read both the text in the book. You will This margin will be called medial margin as well as anterior margin, and this margin will be called lateral margin as well as the posterior margin, because this is how the bone is placed. The tip of my fingers will be the medial, and if you see from the side it will be anterior also. So this is the nasal bone. Here it is making the suture with the frontal bone. In the midline, it is making suture with each other, internasal suture. It is a plain suture. And here on the lateral aspect, it is making a suture with the maxillary bone. On the inferior aspect, it may look like a free margin, and you will see this like this on a dry skull, but in a live person, here there is a cartilage, lateral cartilages the lateral cartilages of the nose, the lateral cartilage. Okay, now let's see the nasal opening. This is the nasal opening. Which structures are forming the this nasal openings? So on the lateral aspect, it is bound by maxillary bone. On the superior aspect, it is formed by the two joining nasal bones. On the inferior aspect, it is again formed by the two joining maxillary bone, but the point that is in the midline, where the two maxillary bones meet, that is called anterior nasal spine. Posterior nasal spine will be seen in the Norma Basalis when we'll look at it. Inside, the which bones are visible from this point of view. Here you see the nasal septum. Nasal septum here comprises of two bones. The one in shown in blue upwards, that is the ethmoid bone, perpendicular plate of the ethmoid bone. The one that is shown here below, that is the vomer bone. Vomer is an independent bone. Ethmoid is the same one that we saw here. It is a very complex bone. We will dissect it more when we go to the nasal aspect. Then there is a shelves in the nose. That is not the part of this lecture right now, but we'll give you a little peek. There are three shelves: the superior, the middle, the inferior. The superior and middle are not separate bones, they are in fact the out projections of the ethmoid bones also. So here you are able to see the middle nasal concha, and middle nasal concha is, let me do one thing. Middle nasal concha and superior nasal concha are part of the ethmoid bone, and here this is the inferior nasal concha. Inferior nasal concha are independent bones. Inferior nasal concha are independent. So this is about the nasal apertures, and you will see here, if we want to look at the 3D model, here you can see all of these structures here. Here is the nasal bones, and here are the three connections with the frontal bone superiorly, anteromedially with the other nasal bone, and laterally posteriorly with the maxillary bones. And here is the nasal aperture. Nasal aperture is bound by nasal bones superiorly, and on the sides it is made up of the maxillary bones, and here there is a maxillary spine. Okay, and what the part of the nose that is visible from this aspect, you see the septum, the upper part that is a perpendicular to it. All of the green part is the ethmoid bone. So you can see the two shelves, the middle line that is the nasal septum, that is the middle concha visible here. Superior concha is very difficult to see, but if you are too eager to see this one where the mouse is right now between the septum and this is the middle nasal, the superior nasal concha. But I won't force on this right now. This is the lateral nasal concha. We will see rest of the bones of the nose when we go to the nasal cavity. So this is about the nasal cavity. Let's move to the maxillary bone itself. So maxillary bone, it is shown in the green here. When you are asked about it, you can talk about its connection. It is joining the frontal bone above, lacrimal bone here, nasal bone here, the other maxillary bone here, and the zygomatic bone here. It is making part of the teeth, it is making later wall of the nose, it is making the hard palate, it is making the floor of the orbit. So the structures, the processes, there is the maxillary, there is the frontal process of the maxilla, there is the that joins with the frontal bones, that is the zygomatic process of the maxilla that joins the maxillary bone, that is the alveolar process, the jaw that we have teeth attached to it, that is called the um, alveolar process. And that's it. And the thing that is important here, the landmarks that will come into your OSP, that is infraorbital opening, infraorbital foramen, anterior nasal spine, and it may be visible here, you may be able to appreciate here the part above the teeth. There is a little concavity in the bone. That concavities are named according to the teeth. Above the incisors there will be incisive fossa, above the canines there will be um, canine fossa. So these are incisive fossa that are present between them. So here are the fossa are a little more uh, visible here. You may see on the groove like there, you may see the fossa between them. Here the alveolar part. So this is all about the frontal bone. Zygomatic bone, if you see at the zygomatic bone is a very irregular bone, and this is the bone that is forming this prominence of your cheek. And the zygomatic bone have a lot of irregular bone, it has a lot of processes. It has this process, the frontal, take part in orbital, and it goes back on the lateral aspect. You will see right here, this will be the temporal process, and here the of course maxillary process, or the main part of the zygomatic bone. On the zygomatic bone, these are the processes are important, and the foramina are important that we saw previously with the orbit, the zygomaticofacial opening here, and on the posterior aspect there. Oh sorry, here the zygomaticofacial opening right here, and on the back there, right there, that is a zygomatico-temporal opening. So these are parts of the zygomatic bone. That is the opening, that are features of the zygomatic bone. The prominence, the part that is joining the frontal bone, the part that is joining the maxillary bone, and the part that is making this zygomatic arch. So this is the zygomatic bone. So we have talked about all of these structured into maxillary suture, foramen, maxillary arch, maxillary sinus. I have not talked about maxillary sinus. Maxillary sinus is basically paranasal sinus. We will go into the detail in the again paranasal sinus and nasal septum. The skull has a large number of air-filled cavities inside it. There is an air-filled cavity right here. Frontal air sinuses, they may or may not communicate with one another. There is ethmoidal sinuses. We have a brief overview or brief mention of them here. There is sphenoid sinuses not seen in this particular view, and here in this view there is maxillary sinus. There is a large cavity inside the zygomatic bone. It's like a hollow cavity bone, and this cavity will be related to the orbit in the superior aspect. It will be related to the nose on the lateral aspect, on the medial aspect. It will be related to the teeth on the base, and in the apex will be going to the temporal bone or zygomatic arch. It becomes important for a few things. One, this is the one that is most largely affected in the those of you may have experienced sinusitis. This is air filled, but in case of sinusitis it may become filled with fluid, so you may feel pain here, you may feel heaviness here. Another important thing is it becomes larger and larger in size as we grow old, as we age. So the bones become thicker and the sinuses become larger. It becomes so large in the older age that the roots of the teeth may not be covered by bone, may be covered only by a mucous membrane, while in the older people. So, if you're especially a dentist and in a medical profession, you must know that dental infection may spread to the maxillary sinus and may spread to the other regions from there onwards also. So, this is about the maxillary bone, maxilla, and maxillary sinus. So, we have talked about the nasal aperture. So, let's make it. We have the frontal bones, vertical arches, frontal air sinuses. We've talked about maxilla, sutures, intermaxillary suture right here. It is not very visible in adults because it is fused. Infraorbital margin, maxillary arch, maxillary sinus. We have talked about zygomatic bone, the structures that it is forming, that is the part of the orbit, the cheek, and articulation, the bone it is forming, the foramina that is present, we have talked about it, the vomer bone, then in the nasal septum, the nasal bones that are forming the nasal, especially the nasal aperture, the occipital margins, and the concha, the shelves that we talked about, the middle concha and the inferior concha. So this is all about the anterior view. I'm right here, not going anywhere. If you have any questions regarding the interior view, I will stop for a minute to wait for your any queries. If there will be none, I will move on to the lateral view. So I'm here giving any opportunity to ask any question regarding this right now. So what is maxillary arch? We have talked about maxillary arch. This the part where the teeth are attached. This part is maxillary arch. Like this thing is maxillary arch. So this part, the upper jaw, you see, this is the maxillary arch. The point where it gives rise to the roots of the teeth. Okay. If you still have any questions, do mention in the comments. I'll come back to them later. Inshallah. Let's move on to the. Yes, you mentioned the date of closure of posterior fontanelle. Dr. Abdullah says that in the embryology we say that it closes in 2 to 3 months of age and it closes at 1 year of age. There is a variation in the textbooks, and this is a wide range. So its average time is usually this. It is basically the range. The 2 to 3 months is usually the early part, and it closes by 1 year of age. So ये हम इस तरह बोलते होते हैं. बाकी मैं I have opened the BT Churasia also. Let me confirm which figures they have given. I know for the fact that both of these figures are given as such in both of the books, because actually there is a lot of space, there is a lot of potential between those two. You may go for 2 to 3 months, because most of the osteology, um, it is most of your examiners will ask the astrology questions from the BD Churasia, and go for 2 to 3 months. Snell has written 1 year, but it is close. You may understand it by it is closed latest by 1 year. So it is like that. So 2 to 3 months is a fairly fine answer. You may go ahead for that. And usually a good teacher usually knows about this variation, and he or she will give you a leverage, inshallah, regarding this aspect. Let's move on. uh, okay. Okay then. I hope so. I have answered your queries to some of the satisfaction at least. So this is about the frontal bone. I did not use this particular picture during my session. I used the 3D model. I am leaving it for the recording. You may pause the recording here and look at the. It is also taken from the Netter's Atlas. Okay, let's go to the lateral view. So which structures are being formed in the lateral view of the skull? क्या कहेंगे इसको? Norma lateralis. Okay, so it is here. So let's move here. Let me be visible myself. Yes. So here is the Norma lateralis. First, we will go to the same order. We will look at the bones which are forming, then we will look at the sutures, then we will look at the other features that are there. So which bones can you see in this particular view? Let's look at the bones that you saw previously. Here there is a frontal bone you can see in the front. In the back you can see the parietal bone. Here you can see the temporal bone. It is one of the most irregular bones. It has a flat part, it has a tuberous part, it has zygomatic part, it has this styloid process, it has tympanic process, it has petrous bone. We will go through them one by one. And here, and the last one you will be see here, the zygomatic bone, and the one new appearance, that is the zygomatic bone, the greater wing of sphenoid, right here. You see, that is the here that it forms the lateral wall of the orbit. It was forming the lateral wall of the orbit. You will be able to see right here. Okay. So let me repeat the bones. There is a frontal bone, there is parietal bone, there is temporal bone, there is sphenoid bone, and there is zygomatic bone. And if we move the zygomatic bone, you will be able to see maxillary bone also. Here, maxillary bone will be visible also. So let's see what we can see. First things first, let's see the sutures between them. Here, between the frontal bone and the parietal bone, the suture, you saw them already in the vertical mode, in the Norma Verticalis, that was coronal suture. Here, this suture, this is the present between the parietal bone and the squamous of part of the temporal bone. So that is known as squamous suture, and पैराइटोस्क्वेमस सूचर भी इसको क्या देते हैं, स्क्वेमस सूचर भी इसको क्या देते हैं. दिस सूचर इट्स लाइक बिवेल्ड. इसके लिए लफ्ज ना बिवेल्ड का लफ्ज आपको यूज होता हुआ मिलेगा. बिवेल्ड होता क्या है कि दिस सूचर इट्स नॉट, इट्स डिफरेंट फ्रॉम दीज सूचर्स. वन बोन इज cut like this and the other bone is like this, so they are oppositely sloping on one another. It's like squamous bone. The squamous part of the tympanic bone, it is overlapping the parietal bone. जिस तरह कलम बनी होती है, ये इस तरह एक दूसरे के ऊपर पड़े होते हैं. These are beveled. These are squamous sutures. Then there will be suture between frontal bone and the sphenoid bone. The name of the sutures will be the name of the two bones, sphenoid, frontosphenoid sutures. And there will be sutures between occipital, the temporal bone, the squamous part of the temporal bone, and the sphenoid bone. And the thing that you must remember right here is this point. Here the four bones are meeting along with their sutures. This is known as pterion. This is known as pterion. Pterion is the point where two bones meet. You must remember from neuroanatomy what is the importance of this pterion. The anterior division of middle meningeal artery. It is the middle meningeal artery. It is running right from here. The posterior division goes back from here. The anterior division of the middle meningeal artery, it passes from this point. This point is viable to breakage. If you get a hit here, this point breaks, and it leads to the breakage of this anterior division of middle meningeal artery. मिडल meningeal artery के बहुत सवाल आते हैं. Middle meningeal artery. And why this breakage and this leakage is important? When this breaks, this leads to which hematoma? Epidural hematoma. And the you must remember, you might have remembered the brain, the central sulcus. So the lateral sulcus, the central sulcus. So the point, the lateral sulcus is right here and the central sulcus is right here. This is the Sylvian point you might have remembered from the neuroanatomy. The brain is right here. So this is the point. This is the, here it is the primary motor area. This is the primary sensory area. So the importance of the breakage at this point is when this point breaks, it leads to the leakage of anterior division of middle meningeal artery. That leads to the epidural hematoma. That leads to the compression of precentral sulcus, and that leads to the paralysis. So this is the important why we focus so much on pterion, why it's important, what's the important point, and if it breaks, it's a neurosurgical emergency. You do a burr hole and remove the hematoma and plug the artery. So this is about the pterion. So we talked about the sutures, the pterion. Let's look a little on the parts of the temporal bone. It's a very irregular bone. The part that is, let me go back. The part that is flat, the part that is here, that is known as squamous part. This prominence, this is called mastoid part. This part that is making the zygomatic arch, that will be zygomatic part. This part that is making the plate that is making part of the opening of the external auditory meatus, this is the tympanic part. What else? If we look a little from the opposite aspect, let's see right here. If we go here, you will see two more things. So you will see this part. I will go into a little detail when we go to the base. So you will see this suture, this part, it's the petrous part. Let me show you here. Yes, so this part shown in the green right here, this is the petrous part of the temporal bone. It is mostly on the undersurface and you will be able to see it when you are looking the interior of the skull. So this is the petrous part and petrous part bone, and this is the, we are left with this thing. this one, this one, that is the styloid process. So these are the different parts of the temporal bone. So each is making different connection. Just open your atlas, just go to the in the museum, you see the bone. The squamous part is fusing with the parietal bone. The mastoid part is fusing with the this parietal bone. The mastoid part is fusing with the making suture with the occipital bone, occipitomastoid, parietomastoid sutures, and then there are sutures present between these parts also, but they're not very visible, so I won't go into the detail. But there are squamous sutures also, better seen in the younger people. You may be able to better see the demarcation lines between this tympanic part and the mastoid part. Here you can see. And then on the inferior aspect, as we go to the Norma Basalis, we will be able to see the connections between the other parts also. Here, the zygomatic part, a few features that are important. Here, you may be able to, I want to focus on two things you must be able to remember, recognize here. So I am outlining this zygomatic part, was this zygomatic part of the temporal bone. This part, this raised part, this is the articular tubercle, and this part, it's the fossa. डेप्थ है, फोसा है, और ये है दैट इज टुबरकल. ये है फोसा tubercle. Let me show you right here. So I have been talking about these parts. So this part, it's called articular tubercle, and this part, the part that is behind it, it is the fossa, better seen here. It's the fossa for the mandibular fossa, because mandible is fitted here. Here in this, you can compare the two here. Here you can see the head of the mandible, the condylite process of the mandible fitting to the mandible fossa. So this is the articular tubercle, the mandibular process. So these are the things. Two more things I would like to highlight here. Here it is demarcated here, this the dotted line. If you move up from the free margin of the zygomatic bone, the frontal process and the zygomatic process of the frontal bone, and you move to the dotted line here, you see this line. This is called superior temporal line. It moves all the way up, back, down, and it becomes continuous with the supramastoid crest. I will go into the superior supramastoid crest right now. So this demarcates the area for the temporal fossa. So this is the area for the temporal fossa. Just below it, just below this area, it's the infratemporal fossa. Infratemporal lines. Just below and parallel to the superior temporal line, here you may be able to see the inferior temporal line. This is present throughout, but it is a little vague and it may end earlier as compared to the superior temporal line before reaching the end. So this is what the temporal lines. Let me show you the temporal lines right here. And let's remove these things. So we've just talked about articular process. Here is the mandibular fossa. You can see in a more detail right here. You can see it goes into the temporal bone. Here the mandible will be fixed. So here are the temporal lines. Here are the temporal lines. Let me zoom out a little. Yes, so this one, if you follow my cursor, this is the free margin of the zygomatic bone, frontal process, and this is the zygomatic process of frontal bone. And where you get on the frontal bone, this is the superior temporal line. It will go all the way around the skull right here. So this is the inferior temporal line. This, the moving back to this zygomatic arch, I showed you the articular process and the mandibular fossa in the inferior margin of the zygomatic process. This superior margin of the zygomatic process, it continues into this prominent ridge. This ridge, it's called supramastoid crest because it is lining the superior aspect of the mastoid bone. Here we are left with again another surface landmark. There is a supramastoid crest, and if we follow, do you remember tangent in the physics? If we are rotating something or rotating a ball on a rope and you leave the rope, then the ball leaves the circle and goes perpendicular to the arc like this. So this line is called tangent. So the word tangent is used. This is the external occipital opening, external meatus. This tangent to the posterior wall of the external meatus. And third thing is this sub external auditory meatus itself. So this makes the मैं मुंह से जहन से वो लव स्किप हो गया, आप में से कुछ चैट में लिख दें, मुझे फौरन याद आ जाएगा. Let me go to my book. This is the suprameatal triangle. This is suprameatal triangle. इसकी आपसी बाउंड्रीज पूछ ली जाती हैं और boundaries are asked in the exams, and the examiner, yes, thank you so much, and examiner do ask you to label these in the skull in front of him or her during your examinations. So this is all about the lateral aspect. What more about lateral aspect? So these are almost all the things that are about the lateral aspect. Let me see if I've covered these things. So we have discussed the frontal bone. We have discussed the bones, frontal, parietal, temporal, occipital is also seen here. I did not mention here. Greater wing of sphenoid. We saw the sutures. The major ones were sagittal, not very seen here. It is present somewhere here. Coronal suture, squamous suture, lambdoid suture. Sternion is the most important part. It is the thinnest part of the bone. The anterior division of the middle laryngeal artery passes behind it. The breakage leads to epidural hematoria, and it leads to the compression of the precentral sulcus, precentral gyrus, so premotor and primary postcentral area also, because it is lying at the sylvian point where the central sulcus meets the lateral sulcus. So we talked about the temporal fossa. Anterior margin is being made by the frontal bone and the zygomatic bone. Superior margin is made by the superior temporal lines. Posterior margin is being made by the temporal lines. Inferior margin, I did not discuss with you. Inferior margin, it's a little tricky. Inferior margin, it is made lateral inferior margin is made by this zygomatic bone here, zygomatic arch here, containing of those both bones. And if we remove the zygomatic arch, you will see this dotted line, infratemporal crest. Let me show you again on here. You will see the zygomatic arch here, and if you are able to appreciate, the bone takes a very sharp bend right here. At this point, the bone takes very sharp bend. Above it, it is almost vertical, and below it is almost horizontal. So this point, this line, it's called what? It is line, it's called infratemporal crest. uh, Let me get back to here. So you will see this aspect, this vertical aspect, and this horizontal aspect. This is infratemporal crest. So this is the margins of the temporal fossa. And if you can see from here, I just said that the lateral aspect it's made by this zygomatic arch, and the medial aspect is by infratemporal crest. This means that this is the medial aspect of the inferior margin, this is the lateral aspect. So we are left with this communication. So this is the communication through which the temporal fossa communicates with infratemporal fossa. So this is the opening between the zygomatic arch and the bone behind that we will discuss again. So this is about the lateral surface. So I'll give again a few minute or two for any questions you have to ask. Just before finishing, let me get to here. Let me get to this. We discussed about the lateral margin. This infratemporal fossa. Infratemporal fossa, I'm talking about the fossa. We'll be talking only about the bony aspects. I'm not talking about the openings in much detail or the communication or the muscles that are present in it. So which structures are forming? So this dotted lines, that lines the infratemporal fossa. This fossa area is visible only when there is a presence, there is a removal of the mandible and there is a removal of the zygomatic arch. So from this picture you can see which structures are forming the anterior aspect. Anteriorly it is made by the posterior aspect of zygomatic bone and posterior aspect of maxillary bone. What I mean by the posterior aspect, it will be a little more clear when we go to the 3D model. Superiorly, it shares the same boundary as the temporal fossa. That is the medial aspect, there is the infratemporal crest, and laterally there will be zygomatic arch. Posteriorly, the defining point is this styloid process. It is not a very good circumscribed or there is closed cavity, but this styloid process as the back. And on the medial aspect you can see from front to back which structures are present. There is this bone. Which bone is this? Maxillary bone. There is this yellow bone, that is the part of sphenoid bone, that is the lateral plate of the sphenoid bone, and just at the base of it a part of the palatine bone. It's seen here. Pyramidal process is seen right here. It was labeled, no, it is not labeled here. It is this pyramidal process, and there is a muscle. I won't be naming the muscles right now, covering here, and at the back there will be styloid process. So these are the bones that are making the medial aspect. This part, this space, there are two words that are used: pterygomaxillary fissure and pterygopalatine fossa. They create a lot of confusion. Um, let me try my best to answer these. Let's get here and let's do some. Okay, I'm a little new to these tools, so let me. Okay, so I have cut the temporal bone. Let me. Okay, so I have cut the temporal bone to show here. So here you can see the a little of the squamous part is also cut during this. So let's see. So here is the infratemporal fossa. Here, if you look from the back, you can see the anterior wall. Anterior wall is being made by the posterior aspect of maxillary bone. It is made by the posterior aspect of zygomatic bone. This is the anterior aspect. Posterior aspect, it is made by this styloid process. Medial aspect, it is made above the maxillary bone, the lateral pterygoid plate of the sphenoid bone. This little part, this one, this is the pyramidal process of the palatine bone. So these are making the medial aspect. And what will be on the lateral aspect? Can you guess? I'm not telling you, you will guess that and mention in the comments. So the middle on the you will tell me what is the lateral aspect. On the superior aspect, there will be this infratemporal crest. Don't worry, this edge is by mistake right now, and on the lateral aspect there will be a zygomatic arch. So we were talking about this fossa. So this whole 3D depth structure that is present between the zygomatic bone and palatine bone and sphenoid bone here, this whole area, this whole fossa, the fossa, it's called pterygopalatine fossa. It is like the 3D space between the two, and the opening between them, like if there is let me try like this. So if this only this face, the front 2D space that is opening between the posterior margin of the maxilla and the anterior margin of the palatine bone, this is known as pterygomaxillary fissure. The whole of the cavity inside, that is basically the 3D space inside, that is present, in which there are the contents and the vessels and everything inside, that is called the pterygopalatine fossa. So for your understanding, for it is nearly synonymous. When we are talking about the pterygopalatine fossa or pterygomaxillary fissure, we are roughly talking about the same thing, but there is a technical difference, that the actual space inside is called the pterygopalatine fossa, and the opening, the curtain in front of it, the point of entry into the fossa, that is the 2D plane, that is called the pterygomaxillary fissure. I think I must have boiled you enough. So I'm giving you a minute or 2 minute break. I'm right here, not going anywhere. So meanwhile, if you have any questions regarding the lateral aspect of the skull, you may post in the comments. I will like to answer it before moving into the a very difficult part, that is the Norma Basalis. Welcome back. I hope you have stretched out your legs and ready for what's coming next. So, what are the questions you have asked? What is the importance of suprameatal triangle? Yes, it's a very good question. Suprameatal triangle, it's present here. It is basically demarcating the surface of the mastoid antrum. It is demarcating the mastoid antrum. We will discuss what is exactly mastoid antrum in the when we study the ear. It's a part of the middle ear. The part it's a space above the mastoid's ear sinuses. So this is the demarcating landmark for when doing mastoidectomy, and there is a surface landmark for the mastoid antrum. So this is about the mastoid process. This is the Forma Lateralis. So let's do the inferior aspect of the skull. Let me set it there also. Okay then. So yes, we are set with this. Let's start with here. Okay, let's start here. What do you see in the posterior aspect, inferior aspect of the skull? Okay, when you look at the inferior aspect of the skull, you roughly divide it into three parts. The part that is at the level of this posterior margin, you make rough lines at the level of the this. Let me open the book side by side, so it will help me also. Where the palatine bone ends, palate ends, and where the foramen magnum starts. Okay, where the foramen magnum starts. Let me. Okay, let's start here. Okay, let me color change the color. So, this part. Oh, I hope so. I will get more smooth over the things over the next lectures. That is a part of the reason I'm doing these things to at least straighten my hand out. So you can make these parts that are not anatomical division, that are just to easily describe the things. Let's the hard palate is in front of it. Then we will see what is at the back. Oh, I just remembered that we did not discuss external occipital protuberance. Okay, we will cover that also. So let's see what is the hard palate. You can see from the color coding, the hard palate is made up of two bones. The one shown in the green, that is the maxillary bone. The maxillary bone, this is called the palatine process of the maxillary bone. And the one shown in the this red orange, that is the palatine bone, that is called the horizontal plate of the maxillary of the palatine bone. So between them, four sutures will be formed. Let's move to the 3D model. So here, let's see here. So this one, this bone and the anteriorly, that is the maxillary bone, and the part that is forming the part of the palate, that is the palatine part. Here was the maxillary arch. Here is the palatine plate, and then there is this horizontal plate of the palatine bone. Okay, so between them you can see sutures. There is a suture between the horizontal plate palatine process of maxillary bones. There are two maxillary bones. There is a intermaxillary suture. The suture present between the two palatine bones is called interpalatine suture, and between maxillary and palatine bone, that's common sense will say, that is, as common sense will say, it's the palatomaxillary suture. Okay, you have to see a few landmarks, that a few important things that are present here. First, this opening. I will discuss the three openings that are present here. This opening that is called these openings, opening number one, opening two, and opening three right here. So this opening right here, this is called the incisive foramen. Incisive foramen leads to a pair of canals, incisive canals, that the right one goes to the the nasal cavity, and same for the left one. Then there is a this greater palatine foramen. Greater palatine foramen, it's present between in the suture of the palatine and maxillary bone, and it is containing the structures with the same name: greater palatine artery, nerve, and veins. And in fact, and then in the posterior aspect, that is in the basically that is the pyramidal process of the maxillary palatine bone. You see that that is the same pyramidal process that was seen here in the pterygomaxillary fossa. Oops. So, a minute. So this is the called the lesser palatine foramina. This is the opening within the bone that is not present between the sutures, that is present within the bone, and it contains the structures by this name again, the the lesser palatine structures and vessel. So what is this structure? This structure is called greater. This contains the. I will go to the structures passing through the opening in a little while, and so this is the great incisive foramen, and it leads to incisive canal. So let me, okay, moving on. Here you see this prominence. The prominence you can see right here. This is the posterior nasal spine. Let me show you here right now. That is called the posterior nasal spine. It is shown right here. Okay, so this is all about the palate, and here you can see these are the pits and grooves. Here the gum is very strongly attached to the hard palate here. So gum is very so the mucosa is very high, attached to here. So it shows the pits and grooves for the attachment of mucosa here. So this is about the hard palate. We discussed the four bones, two maxillary, two palatine. We discussed the four sutures, three sutures: intermaxillary, interpalatine, and palatomaxillary. Three openings: incisive to the nasal cavity, greater palatine and lesser palatines, and this posterior nasal spine. Let's go to the back. What you can see in this part. Okay, here you can see the posterior nasal septum. Let me get you. So this is the nasal cavity. We're seeing upside down, so it may be a little confusing. So this is the nasal cavity, vomer bone. If we were looking at this, we almost in the posterior aspect, we don't see the perpendicular plate of the ethmoid bone, we see only the vomer bone. In this aspect, we see these a pair of bones that are the part of the sphenoid bone. A lot of sphenoid bone is seen here. That these two plates, let me get it straight. So these plates, they are very nicely seen in the lateral aspect that I have just said. These are called pterygoid plates. Pterygoid process, the whole of it is called pterygoid process, and it is further divided into two plates. It is joined anteriorly, and it's towards my face is the anterior. It is joined anteriorly, and posteriorly there are two free plates. So here you can see it is the two plates. So these are known as medial pterygoid plate, lateral pterygoid plate, and in between them there is fossa, pterygoid fossa between them, and the pterygoid fossa present between them, and the medial one contains this prominence that is known as hook of Hamulus. Um, Do tell me know if I'm losing you or if I'm making things too complicated. Do let me know so that I may adjust accordingly. It's very a little unnatural for me to just talk to the recordings, but inshallah I will grow with it, inshallah. So here the sphenoid bone, you can part of the see the pterygoid plate of the sphenoid bone, you can see here. This is the greater wing of sphenoid. Um, right here, the expanded part, the part we saw on the lateral aspect, the part that is, this was the infratemporal crest, and this is the part that contains the two openings that you read, that you studied in the anterior aspect of the skull, that was foramen ovale, foramen spinosum. And you see a part of the body of sphenoid here. It is right here, this part where the mouse is, this part, uh, like this. So this is part of the body of the sphenoid. The difference, the suture is shown between the part of it and the part of the base of the occipital bone, but in practice it's usually very vague and usually not seen. So that is about the sphenoid bone on the inferior aspect. So what I have talked about it by now is that in the midline you can see the vomer bone, it's independent, there is no ethmoid bone. Here you can see the two power plates of the palatine bone. They're joined anteriorly and free posteriorly to form the medial and lateral pterygoid plates. So this is the lateral pterygoid plate. This is the lateral pterygoid plate. This is the medial pterygoid plate. And in between them, so let's take the parts of the sphenoid bone. Let's check if we have covered all of these. We have this whole of it is called pterygoid process, and it contains this medial plate, this lateral plate. The medial plate has a downward extension, this one that was called humulus, and lateral plate does not have a counterpart extension, and the fossa that is present between these two, these are known as pterygoid fossa. The whole of this part that is present between these two, this space, that is present between them, that is pterygoid fossa. So there is a students ask me what is the difference between pterygoid fossa and the scaphoid fossa. So here the thing that is present between the two plates is pterygoid fossa, but if we trace the medial pterygoid plate up, it is dividing into two parts right here. So the point between these two, that is the scaphoid fossa, and the present that here, that is the pterygoid fossa. So that is known as pterygoid fossa. So these are the fossae that are present here. Pterygoid plate, here is the pterygoid humulus, you can see right here, and medial pterygoid plate, lateral pterygoid plate, the rest you can make it up. Let me show you how to make things up. The medial pterygoid plate is medially related towards the internal opening of the nose. The lateral aspect of the medial pterygoid plate is related to the pterygoid fossa. The medial aspect of the pterygoid plate is related to the pterygoid fossa. The lateral aspect of the lateral pterygoid plate is related to the infratemporal fossa. So you can make all these things up as you go along. So let's see what we can see on the rest of the sphenoid bone. On the rest of the sphenoid bone, you can see here these openings. This opening that is called the foramen ovale right here, and this opening that is called foramen spinosum. I will go into the for the structures that are passing through it. Here at this point you can see the margin, the groove bed that is present between them, that is called tubal groove. That, can you guess which tube will be present here? The cartilage of the escutcheon tube will be present here. And the rest, the important landmark is this infratemporal crest. And then if we move front, we will go to again to the same pterygomaxillary fissure, pterygopalatine fossa, and we will go to the same infratemporal fossa, and all the same things will be here. So which junctions it is making? Let's just keep it simple. It is making junction here with the occipital part of the bone, with the basio-occiput, you discussed in front in the neuroanatomy. Here it is making a junction with the petrous part of the temporal bone. This hole is the petrous part of the temporal bone, and in this fissure there is an opening groove for the escutcheon tube, and you will see this opening for the institution tube opening right here. Let me try isolate that opening right here. You may be able to see the opening of the where institution canal will exit. And any landmark I'm missing, can you help me with it? So this is it, and here is the spine of the sphenoid. Let me, it's right here. It is not, I'm not very able to, like, sorry, it's right here in front of the foramen. Let's now, let me, give me 1 second. I want to, it's better to appear naive than wrong. Spine of sphenoid, it's right here. It is very well shown in the Nettes atlas, just behind the foramen spinosum, because it's beneath the foramen spinos O. So that is the spine. And here I may be or may not be able to show you right now, but you get the idea. This point, it's not very prominent right here. So let's stick with the that with the open the netters picture. So this point is foramen spinosum, the point behind the for spine of the sphenoid bone, just behind the so we had discussed this groove for the pharyngotympanic institution, auditory tube, the opening for the auditory tube. There is a petrosphenoid groove we discussed, and on the lateral aspect there is the same things that will be shown the bone, that will be the part of the temporal bone, that is the fossa. Oh, sorry. That will be the fossa for the mandibular fossa, and behind it, here you will see the tympanic plate. You can see it is a roughly C shape. It is majorly covering the anterior aspect, inferior aspect, and part of the posterior aspect, not the whole. So this is the tympanic plate. Uh, this thing is tympanic plate. So the tympanic plate you can see right here. So what else can you see? You can mention in the comments what else can you see. If I'm missing anything, do ask and do correct me. um, this is the mandibular fossa, tympanic plate. So let's move on to the parts of the petrous bone. Okay, and we have uh, this opening, this opening front in the opening. Let's start with the foramen lacerum. This is the foramen lacerum. This is the opening between the two bones. It is present behind the sphenoid bone. It's anteromedially there is a sphenoid bone. There is a pterygoid process, and there is a body of the sphenoid medially, pterygoid process anteriorly, and the posterolaterally there is a apex, the tip of the petrous bone. One more feature, petrous bone is triangular. It's this point is pointed. It is making sutures with sphenoid bone anteriorly, squamous part here, and the occipital bone right here. And it is making two grooves with each of the sutures. Here it is making the groove for the uh, between the for the institution tube. Here it is making the groove for the institution tube. Here it is making the groove for the inferior. Here it is making the jugular foramen. You will see right here between these two parts. You will see jugular foramen right here. What openings can you see? Openings that you will be able to see right here should be this canal. This is the carotid canal, and just give me a second. थैंक यू फॉर वेटिंग, सॉरी फॉर द इंटरप्शन. लेट्स स्टार्ट. और यहाँ बैक पे आपको क्या नजर आ रहा था? हम यहाँ कैरोटिड कैनाल देख रहे हैं. कैरोटिड कैनाल ये वाली है, कैरोटिड कैनाल. एंड देन देयर इज अ जस्ट लेट्स मार्क द थ्री ओपनिंग्स. here is the carotid canal. This one is the jugular foramen, and you don't see it in this view, but let's rotate our model a little and you will see this. This is an opening that is present between the two processes. This is the styloid process in front and mastoid in behind. So that is the stylomastoid foramen. That is very important because facial nerve passes through it. So these are the structures, major structures, the major structures that are aspect on the this aspect of the base of the occiput. You can see this. This is the, let's see on the netters. What does netter say? So so we have seen the plates. So let's see. So we saw the zygomatic process, articular tubercle. We have seen the mandibular process, styloid process, petrotympanic fissure. I did not discuss with you. Um, this is the petrotympanic fissure. You can guess by the name of the two things. Let me. Okay. This is a petrotympanic fissure. That is the petrous part of the temporal bone and the tympanic plate. Right here. Let me show you concomitantly. Here, it is a petrotympanic fissure. Go to here and this point, this point that is present between this groove. This is petrotympanic fissure. Just remember the name. We will discuss it then. We will discussing the chorda tympani, how the different structures get out of it. This is the petrotympanic fissure that has a small opening shown right here. Small opening shown right about here that gives the opening of the nerves that are passing through it. I'm not going into the detail here, but that is the petrotympanic fissure. So what else do we have to discuss? Carot would discuss the carotid opening canal, tympanic canaliculus. I did not discuss with you. Tympanic canaliculus will be the tympanic canaliculus. I did not discuss with you. It's an opening just behind the carotid canal that also goes to the middle ear. Then there is external acoustic meatus, mastoid process, talomastoid foramen, and the facial nerve moves through the groove that a muscle that is passing through it. For there is a mastoid digest groove here, and that is for the, I'm little blanking. That is the occipital groove. That is the groove for the digastric muscle. Uh, petrous bone. We have discussed the foramen, jugular foramen, all of that. Let's move on to the back part. It is very little things that you have to actually remember. Mm, So let's jump into them. Okay, let me try to get it as I want. Yes, it's of my liking. Okay, so this part, that is fusion of the sphenoid bone in front and the occipital bone in the back, that is the main part, that is the basilar part. Basilar part of the occipital bone in front, it is fused with the basilar part of the temporal bone. Okay, this raised portion in the midline, this is the pharyngeal tubercle. You will discuss that in the pharynx when we will discuss the attachment of spiropharyngeal constrictor and the pharyngeal fasciae, and the two raised portions that are known as condylar processes. Occipital bone is there, so this is known as occipital condyles. The big opening between them, that is known as foramen magnum opening, big opening. And there is this vertical line that is known as nuchal line. Sorry, that is known as external occipital crest. External occipital crest, nuchal line horizontal वाली थी, that is external occipital crest, vertical line होती है, anteroposteriorly run कर रही है. This is the point जहां मेरा इस वक्त कर्सर अगर आपको नजर आ रहा है. This is the point. This is known as external occipital protuberance. अगर आप बैक पे फिट करें अपना मिडलाइन के अंदर, अपने आप को पैल्पेट करें, एक बड़ी मिडलाइन के अंदर रेज सी स्वेलिंग आपको फील होगी, बड़ी प्रोमिनेंट फील होती है. दैट इज नोन एज एक्सटर्नल ऑक्सीपिटल प्रोटूबेंस. उसके बाद एकदम से स्कल अंदर टिप कर जाएगा एंड यू वॉन्ट बी एबल टू पैल्पेट द बोन. सो दिस इज दैट पार्ट. This is the demarcating between the posterior aspect of the skull and inferior aspect of the skull. This is the external occipital protuberance. The lines that are running parallel to the posterior aspect, external occipital protuberance, these are known as superior knuckle line. If you move down the external occipital crest and the lines parallel, and in this area basal part, this is known as inferior knuckle line. And there is also higher knuckle line that is seen in the posterior aspect. I will get to the 3D model shortly. Three major openings you can see here. The opening foramen magnum, that is the major one. The major opening that is in front of this occipital condyle, that is the hypoglossal canal for the hypoglossal nerve. And the small opening that is behind, that is known as um, this condylar canal, condylar fossa. Sometimes in some books there's anterior condylar, posterior condylar is mentioned, that is talking about the hypoglossal and the condylar canal respectively. Because we have given it name the hypoglossal canal, we usually don't say the anterior posterior aspect. And there is one opening that is seen here between the squamous part of the temporal and the squamous part of the occipital and the temporal bone in this suture, and the mastoid part that is that is called the mastoid foramen. There is emissary veins that are joining the superficial surfaces to the sigmoid sinus internally. So let's move to the skull. Let me get a more feasible view. So this is the skull here. So here you can see the basal part. Just in front of it, two condyles. If we see on the anterior aspect of the condyle, here you can see the hypoglossal canal. This is the hypoglossal canal right here. So hypoglossal canal you can see here. On the back aspect, here you can see the posterior your condylar canal. Then I will show you the mastoid process, mastoid opening. It will be present somewhere over. Let me Here you can see here it is not drawn in the suture, it is drawn in the mastoid process. This is a mastoid foramen. Okay, let me go into the posterior view to better understand the external occipital protuberance. Let's get to here. Yes, so we are right here. So this point, the part that you make prominent, that you can feel right here, this is the external occipital protuberance. This part is the external occipital protuberance that you can see right here. External occipital protuberance. The lines that are demarcating from each sides, that are known as superior knuckle lines, that are here, that are known as higher or supreme knuckle lines. And the one not clearly seen in this view, but if you tilt the skull the little here, you can see that these, you can see inferior knuckle line. You can see this inferior knuckle line right here, and external occipital crest is visible right here. So this is about the base of the skull. What's the time right now? It's almost time. So we have discussed the inferior view of the skull, um, and all of the features. So let's take all the things we have done. We have done hard palate, maxillary and palatine parts, the sutures that are present behind them. Coena. Coena is the posterior nasal aperture. We did not do the boundaries of this. So this is the posterior nasal apertures. We will again do in the inshallah um, part, in the nasal part. So this is the posterior nasal aperture. You can make the boundaries from the picture itself. So which structures are making it? Inferiorly, there is a palatine bone, the horizontal plate. Medially, there is a vertically palatine part. Laterally, there is the medial plate, free margin of the posterior free margin of the medial plate of the medial pterygoid plate. And upper end, there is the body of the sphenoid bone. So these are struck making the posterior nasal aperture, or otherwise known as coena. Then we discussed the pterygoid plates, the pterygoid fossa, the scaphoid fossa, pterygoid fossa, the scaphoid fossa, pterygoid plates, pterygoid humulus, the lateral part, the squamous part, the two openings here, the infratemporal crest, the sutures present here, When we moved on to the temporal bone, before moving on to the temporal bone, we discussed this fossa, this groove for estrogen tube, opening for estrogen tube, then discuss the foramen lacerum, its boundaries, and the petrous part, opening for carotid sinus. Just behind it, there was tympanic canaliculus. This was Starlight process. There was tympanic plate. Just ahead of tympanic plate, there was petrotympanic fissure. Just ahead of that, there was fossa for the mandible, condylar process of mandible. There was external meatus. Then between the mastoid process and this was stylomastoid foramen, and the groove just behind it, containing the digastric muscle, mastoid was. And moving on to the posterior aspect, we saw the uh, basiocciput, pharyngeal tubercle, occipital condyles, anterior posterior foramina, that was for the anterior was hypoglossal, posterior was condylar canal. Then there was external occipital crest, external occipital rhodomus, knuckle line. These were inferior knuckle lines, and the higher one did not discuss with you in the basal part. I think I don't have the picture right now. I can add it later. So there were higher knuckle lines. So all of these, I hope these have been covered. Um, so this is the last slide for today. Just I'll briefly go through the structures which are passing through the openings that we just saw in the inferior aspect of the skull. So there is this is the point, this is the part that you have to memorize with all your energy. You have There is a lot of MCQs, there is a lot of exam questions asking, okay, this is the opening, which structures are passing through it. Let's go through them one by one. So this was the incisive canal, incisive fossa. The artery and vein have different name here. The artery which passes through it, it's the nasopalatine, sphenopalatine vessel. You will see two names right here. Sorry, you will see two names right here. You will, in different books you will read sphenopalatine, and in few books you will read greater palatine. I think mm, um, let's see. Okay, you will see greater palatine also. Why it's written like this in this? Because greater palatine artery is the one that comes from here, and it comes inside here, goes inside, and from the nasal aspect the sphenopalatine vessel is coming downwards. The both of these anastomose right here. So in different books you may get, in addition to greater palatine, you may get, in addition to sphenopalatine, you may get the heading of greater palatine also. So don't be worried, it is because these two are fusing right here. The nerve that is passing through it, it's totally different name, that is known as sphenopalatine, that is known as nasopalatine. The artery is sphenopalatine, the vein is nasopalatine. Then there is greater and lesser palatine foramina, and both have the same names. There is a greater and palatine, the structures containing have the same name, greater palatine nerve artery vein, lesser palatine nerve artery vein. Then there is known as greater petrosal nerve or foramen lacerum. Foramen lacerum is a very tricky topic. Um, I always say that don't want to go into the detail, but I do go into the detail. So here I go. Let me give you a little background. Foramen lacerum is like this. This is the bone here. Here is the bone right here. It is the opening for the, okay. This is the foramen lacerum. The foramen lacerum. Actually, what happens is that here in the petrous bone, there is an opening for the carotid artery. Carotid artery comes from here, moves through the carotid canal, curves right here and move up. So here the carotid artery just bends up just on the top of the foramen lacerum. So technically speaking, it is not passing through the foramen lacerum, but because it's of its close proximity with the foramen lacerum, Snell and some other books do mention that it is a content of it. It is not technically very true. Also, the lesser petrosal nerve, here about here there is a pterygopalatine fossa. right here. There is a pterygopalatine fossa. So there is a palatine bone in front of it. So the nerve, it also passes through here and it goes through a canal to this point. So this is lesser petrosal nerve. No, this is not lesser petrosal nerve. This is sorry, the nerve that is passing lesser petrosal nerve. I will discuss it more with the cranial nerves exact is pathway. I think I have not done justice with it. So technically speaking, these structures are not passing through the foramen lacerum. This is the thing you must remember. These are passing just above it. So in Snell and in Netter, you may get a different options, and that's the reason. Greater petrosal nerve is written here. I said lesser petrosal nerve, but it is greater petrosal nerve. It passes just on the top of it. Internal carotid artery passes just on the top of it. You see, foramen lacerum does not have written greater internal carotid artery, and here foramen lacerum internal carotid artery is not written. It is written here. So if given the option which internal carotid artery passes through carotid canal would also always be the better answer. So which other structures are passing? Foramen lacerum we have spent so much time on. Foramen ovale contains the mandibular division of the trigeminal nerve. In addition to it, lesser petrosal nerve passes here and the accessory branch of the middle meningeal artery. Accessory middle meningeal artery. Then there is foramen spinosum, middle meningeal artery. Everything related to middle meningeal artery is very important in the exams. It passes through which opening, and it passes through Tyrion and all the story of the breakage. And then there is an opening of the carotid canal, carotid opening, carotid artery passes through it along with the sympathetic plexus that is surrounding its wall. Just behind the carotid canal, there is the tympanic canaliculus, the tympanic branch of the glossopharyngeal nerve. Inshallah, we will discuss in the cranial nerve portion. Passes, exits here. Then there is a mastoid canaliculus and stylomastoid foramen. Mastoid canaliculus, um, it has some branches of vagus nerve. If you forget it, don't worry, it is to be forgotten. Petrotympanic fissure, that's an important content that's usually forgotten. That is a coda tympani, the part of the facial nerve that exits the middle ear and supplies the salivary signals and the taste signals to the tongue, and salivary signals to two of the three salivary glands. And then we come to this stylomastoid foramen, the most important facial nerve. Stylomastoid has a very interesting MCQ. The mastoid process, it is usually developed by 2 years of age. So before, in the newborn, when the newborn is being born, the facial nerve, the stylomastoid foramen, it is not covered laterally by the mastoid process. So in newborns, the facial nerve is relatively exposed on the lateral aspect of the skull near the stylomastoid foramen. This becomes very important in the gynecology and obstetric practice because wrongly placed forceps can have a direct pressure on the stylomastoid foramen, then on facial nerve, and leading to the facial nerve palsy. So this is an important MCQ. So that stylomastoid foramen, it is guarded by mastoid process, and this guarding starts after 2 years of age, after the mastoid process has developed. Before it is only covered by sternocleidomastoid muscle. Then there is jugular foramen. Jugular foramen contains the jugular vessel, interjugular vein, and the last four cranial nerves. Last cranial nerves, that is glossopharyngeal vagus accessory nerves. Then there is hypoglossal canal. In addition to it, it may contain some vessels, veins. Otherwise, it's the hypoglossal canal. This is the mastoid foramen. Mastoid foramen contains the mastoid emissary veins that connects to the sigmoid sinus, and then the foramen magnum. Foramen magnum contains the last part of medulla oblongata. It is actually the transition point between the medulla oblongata and the spinal cord. So both can be seen in the contents: medulla oblongata lower part, spinal cord upper parts. And in addition to that, extra structures, you must remember that the arterial system is going up, that is the vertebral arteries. Its branches are coming down, that is anterior and posterior spinal arteries. Venous plexus around the vertebra, that is going around. Meninges, all three layers are going through it. And the nerve that is important that is crossing it is the spinal root of the accessory nerve that was arising from C1 to C5 that moves up the foramen magnum to go into the posterior cranial fossa, and then again with the subarachnoid space and the CSF and all those structures. So these are the fissure and the foramina. So this is the skull. We are left with the superior view of the interior of the skull. Foramina in the interior of the skull I have not discussed in this particular lecture. So before concluding, any question, any query, any suggestion, at least before any question regarding the base of the skull, I am leaving it at this slide that you want to ask, then we will close. You may mention in the comments. Okay then, thank you. So the most of the pictures I took is apart from the first one were taken from the Netter's Atlas. You can go ahead and look for yourself. And the atlas I was using, the 3D atlas, it was Complete Anatomy by 3D for Medical by Elsewhere. You can just Google it and you can find the atlas. The bony part is free, and the rest of the soft tissues you can purchase it for a price that will be listed. There are other 3D models available which you can find. Thank you so much for staying with me throughout. I hope so. It was more beneficial than confusing. And do give your feedback. I'm present here. If any question for regarding the today's discussion, do ask me. If any feedback you have, any suggestion for the subsequent lecture, we have 10 lectures in this crash course. If there is a particular way you want this course to be continued, so do tell us here. As far as the interior of the skull is concerned, let me make a recording. I will upload it separately. I have on our page, I have make a separate album that will contain all of these live sessions or the uploaded lectures from this. Thank you so much for listening. Any comments, questions, feedback? Okay then. Thank you so much for being with us. Inshallah, see you in the next lecture. Uh, do let us know in the comments what you think about this and how would you want me to improve over the next lectures. Till then, good luck and Allah Hafiz. Have a happy vacation.